can you fire a patient? Can a patient fire a doctor? And what happens if you don't have insurance and you're in an emergency? Well, what happens during the emergency? And then what happens after the emergency? Once you're stable, technically they can discharge you. So whether you have insurance or not, you have to be taken care of in the ER. What happens after the ER is a different story. Then now typically they will refer you to whatever physician field that's in their roster. Patients are free to choose whoever they want to see in the outpatient setting. Doctors do have a mechanism where they can fire patients that they feel there's nothing more that they can do or whatever reason.
We gon' do it like it's priceless. Take it to the moon. Priceless. One day will be soon. Like it's priceless.
Hey everyone, welcome to another episode of D-Talk with Dr. Pham. So today I'm going to talk about a topic that a lot of people have actually messaged me and asked me if I can do an episode on it. And it's about, can you fire a patient? Can a patient fire a doctor? And what happens if you don't have insurance and you're in an emergency? Well, what happens during the emergency? And then what happens after the emergency? So I'm going to kind of cover, broadly all of that, okay? So first off, every doctor can attest to this. You're always going to have a patient that no matter what you do, they're just not happy for whatever reason, and either they keep asking for pain meds or, they have all these symptoms that you just can't find the source of. And as physicians, we get frustrated because we're supposed to be problem solvers, right? But we get frustrated because we can't seem to find the answer. And the patient gets frustrated because we can't find the answer and they're wanting an answer and, and they're suffering and, whatnot. So, but you really can't, let's say you're taking care of a patient, you really can't just decide that, you know what, I'm not going to take care of you anymore, okay? So on the inpatient side, if you have a patient that you've been taking care of and that patient is just not happy with your care, well, as a physician, you can request a second opinion if there's another specialty like yours in that hospital. So what do I mean by that? Let's say if I'm at hospital A and I'm the surgeon and I got consulted on patient X and patient X really was just very difficult to deal with. Well, before seeing that patient, the doctor has two choices, right? The doctor, if he or she is paid by the hospital to take call, then they are obligated to see that patient, regardless of whether they like that patient or not. And then if they see that patient and there's really nothing that you can do for that patient, then you just tell the patient that, like, I'm not sure, Miss X, what's causing your issues. That's kind of out of my realm, of specialty. And so if it's something that's life-threatening or whatnot, then you transfer the patient to a higher level of care. So another hospital that has urology. And so then, you initiate this through the transfer center and all that. A second option is if the doctor is not paid by the hospital to take call, then that doctor is under no obligation to see that patient. So even if, let's say, the patient's bleeding to death, if that doctor is not paid by the hospital, he or she is under no obligation to have to intervene if he or she does not want to. Now, most doctors will, but I'm just telling you kind of the legal side, I think from a physician side. I'm not a lawyer, so obviously I can't go into very specific details like a lawyer can, but these are things I know because when we sign the call contract, I read these things. Now, if the doctor does take call for the hospital And then the doctor is obligated to see that patient. But if the doctor sees that patient and feels like he can't really do or can't figure out what's going on, then he can actually talk to the primary team to consult another urology service who may be on call or not on call, but but if that other urology group is on call, then technically they have to see the patient. If they are not on call, then they can decline. And like I said, most doctors won't, but they can. And so that's kind of in the hospital setting. Now, outside of the hospital setting, what if you have a patient that, for whatever reason, they take up too much of your staff's time because they're constantly calling about paying medication refill or calling about things that is just really out of your control, like they're having pain, but you really don't have a source or whatnot, but they refuse to take your advice and seek a second opinion, which is typically what I would do first, is if I feel like it's a patient that I personally can't help, then I would tell them, hey, I think this is a time to seek a second opinion because I'm going to be honest with you, Miss X. It's really outside of my realm of specialty, and I don't think I would be able to give you the best care possible. And most patients will take that as, and they won't fault you for that. No one expects you to know everything, right? I mean, medicine is so big and wide. One doctor just cannot know everything. That's why we have specialists, and then we have people like me that are subspecialists. And specialist just means, because I'm a urologist, by definition, I'm a specialist. And then subspecialist means that I did more further training beyond my urology training. And so that's all it means. But let's say that patient was like, no, or let's say that patient did get a second opinion and didn't like what the other doctor said, but doesn't want to get another opinion. Well, then, but you feel like there's nothing more you can do for this patient. And then at this point, this patient really is just taking up time, but you're not really able to do anything for Miss X. So then the right way to do it would be you would write a letter. And I don't know if it needs to be certified or not, but I would. And send it to the patient, and you give them 30 days to find a new doctor to take over her care. And during those 30 days, you will continue to care for her. And then after that 30 days, you are no longer obligated to have to see her. And that's my understanding. Now, if you're the patient, well, then that's easy. You don't need to fire a doctor. You can, if you don't like Dr. A, you can go see Dr. B. Now, if Dr. B or there's no other doctor that's inside your insurance network besides Dr. Pham, and Dr. Pham is such an asshole that you don't want to see him anymore, then I guess in that case, I've never had that happen, but I guess in that case, you call your insurance, and usually they can work something out where they will agree to let you see another urologist for X amount of time or whatever it may be. And so I've seen that happen before. And so that's kind of how things work. Now, what about if you got a gunshot wound and you were in the ER? Well, the ER is naturally contracted by the hospital to take care of you. So the ER's job the key here is to stabilize you. And typically, the ambulance will take you to a hospital that is trauma related. And when I say that, what I mean is that usually hospitals that are trauma related, I won't get into like what level 1, level 2, level 3, level 4 means, but the ambulance will know, EMT will know where to take you, where they would have all the specialty that would be available to help you with what you need. And, to open an ER and to be classified as a trauma center, you really do need a certain type of doctors. And so last I checked, urologists are not that is required that the hospital has to have on call. And so, but let's say you got a gunshot wound, EMT drives you to a trauma hospital and they're able to stabilize you. The key here is stabilization because, you can get shot in the spine and you're bleeding. So their job really is to stop the bleeding, make sure that you'll survive, but they do not have to make sure that your spine is fused if that's not going to cause you to die. So what I mean by that is once you're stable, technically they can discharge you. So whether you have insurance or not, you have to be taken care of in the ER. What happens after the ER is a different story. Then now typically they will refer you to whatever physician field that's in their roster. So for instance, let's say you came in and motor vehicle accident and your bladder got ruptured from a pelvic bone fracture or whatever. So orthopedics takes care of the bones, the pelvis, all that. Urologists, if there's any bone fragments, anything like that inside the bladder, then we would obviously take that out, repair your bladder, and do all that good stuff, stabilize you. But then let's say that you still needed, let's say you're incontinent now because of the bladder injury. Well, there's nothing for the urologist to do while you're in the hospital except, place a catheter or something. And then so if you have insurance, well, then that's easy. You just follow up with the doctor and then you go through the routine care or whatnot. If you don't have insurance, then, now that this, I don't know if it's a law or is it just something that is kind of ethically the right thing to do. And that is to see if you operated on that patient, then to see that patient at least once after surgery. And then if it's something that's non-life threatening, then the next visit, then that patient will need to be financially responsible for the next visit, plus whatever cost that was incurred in the hospital. So keep in mind that even though a physician may be on call, that means that they cover call and see you as a patient, but they still bill you for their professional fees, whether they saw you as a consult, as surgeries, or whatever. What the hospital is paying for is just to have that specialty available in the event that that specialty is needed. Okay, so I hope that makes sense. And so, because a lot of even doctors don't know kind of how to navigate this, but that's kind of how our healthcare system kind of works. Is patients are free to choose whoever they want to see in the outpatient setting. Doctors do have a mechanism where they can fire patients that they feel there's nothing more that they can do or whatever reasons. And then from the hospital side, if you're seen in the hospital, that's kind of how things go. So I hope this episode helps patients and doctors understand kind of the ramifications of being an on-call doctor versus being a non-on-call doctor. And then how many visits do you give a patient who is uninsured? And really, what is your responsibility towards that patient? Okay, so I hope that episode is helpful. And last but not least, click the subscribe button and give me a thumbs up so that I can continue to do this. And then if there's any topic that you would like me to discuss, please feel free to leave a comment. And I certainly will do that. And if I don't know enough, I will find someone that does and get them on here. Okay? So until next time, Dr. Pham signing off.
Look, it's priceless. Take it to the moon. Priceless. One day will be soon. Look, it's priceless.